So, total joint replacement. There are hundreds of thousands of total hip and knee replacements performed every year. It's a very predictable surgical procedure with very low potential risks and a relatively high satisfaction rate, as is the case with technology in every field. The technology in orthopedic surgery and total joint replacements continues to improve and provide more long-lasting total joint replacements for patients with improved function. MIS, minimally invasive surgical technique, and computer-assisted navigation are a couple of the small steps along the continuum of continuing improvement in regard to total joint replacement. A little bit about total hip replacement specifically, or hip arthritis. The indications for total joint replacement, again, we go back to the main reason that brings the patient to the doctor: pain. Pain for hip problems is typically in the front of the hip, the groin, and oftentimes it'll radiate into the thigh or down towards the knee. A patient that comes in and puts their hand on their lower back or their buttock, the first thing you think of is a spine problem. So it's less likely that it's a hip problem if the patient isn't specific about their pain being in the groin and the thigh. You can still get pain in the buttock and the back of the hip area with hip arthritis, but the primary component we're looking for is groin pain. Of course, we typically don't take patients to the operating room until they've failed conservative treatment. And that's all of the treatment options that I had mentioned earlier. Also, we need to make sure that it's arthritis that's causing the pain. So the x-rays need to confirm, along with the examination, the arthritic change in the joint. The ultimate decision is the patient's. When they've come to the conclusion that they've tried everything and they don't want to live with the pain and the symptoms anymore, and they want to improve their lifestyle. There's a number of different materials that we typically use for joint replacements. The vast majority, of course, are some form of metal, titanium, cobalt, chrome, and then the plastic, which is typically what goes between the two metal surfaces. It's referred to as polyethylene. The polyethylene has markedly improved over the years, referred to as medical grade polyethylene. And the wear of polyethylene, because of the improvements in the biomechanics of the material, are such that the wear will virtually last anyone a lifetime, which is important because there's some controversy about what other folks have heard about metal on metal hips, which is something that is being talked about a lot because of metal wear debris on metal and metal hips. And Jack Nicklaus, the golfer, made the ceramic hip popular. There's some issues with ceramic as well. The gold standard remains the polyethylene, the plastic on metal, in terms of the materials that are used for total joint replacements. The fixation of the components, the implants, often is with cement, referred to as methyl methacrylate. And you can think of methyl methacrylate, the bone cement, as a grout, holding the prosthesis in place where the bone is. Hip replacements in particular have come to the point where, if the bone quality allows, if the anatomy allows, we make every effort to put both the cup side, which we call the acetabulum, as well as the femur side in without cement, with implants that have porous coating, we call it, to encourage bony ingrowth or biologic ingrowth. Knee replacements have done so well with cement fixation that cement fixation of knee replacements, particularly the tibia component, remains the gold standard.